Tumor Board Minutes, quick guide to clear recommendation statements. Tumor Board Minutes exist to capture more than a list of cases. They record the clinical decisions and the reasoning behind each recommendation so teams can act confidently. Good minutes provide a clear, time-stamped account that supports legal and quality assurance requirements, demonstrating that multidisciplinary input informed care. They also enable continuity of care. When a patient moves between clinics or providers, minutes summarize what was decided, who said it, and why. In short, thorough minutes protect patients and teams, reduce misunderstandings, and keep complex care coordinated across specialties. Clear recommendation statements eliminate ambiguity about the next steps and who is responsible, which is essential in fast-moving oncology care. When a recommendation is specific, it becomes easy to audit, follow up, and track outcomes, vital for quality improvement and research. Precise language also helps clinicians, patients, and administrators interpret decisions the same way, reducing repeated calls or delays. Ultimately, crisp recommendations save time, improve patient safety, and ensure everyone involved understands what should happen, when, and by whom. A reliable template guides authors to include 5 essentials. Start with an action verb, a clear intervention such as recommend, so the recommendation reads as a directive. Specify the target, what procedure or therapy, for which patient, and the tumor site or staging details. Add timing and urgency, when the action should occur, and any follow-up schedule. Name the responsible party who will implement or coordinate the plan. Including these elements consistently turns minutes into practical, actionable instructions that teams can execute. Every recommendation should include a concise rationale explaining why it was chosen, linking evidence to the plan, summarize key data that influence the decision, critical imaging findings, pathology results, or relevant comorbidities, and explain how they change risk-benefit considerations. Note reasonable alternatives considered and why they were rejected, so future reviewers understand the decision pathway. This brief clinical reasoning supports transparency, helps when plans change, and provides educational value for learners and auditors alike. Concrete examples show how the template works in practice. Example 1. Recommend surgical resection of left lung mass, oncology to evaluate adjuvant therapy, surgery within 4 weeks. This gives action, target, timing, and a next step coordinator. Example 2. Recommend systemic chemotherapy for stage 4 disease, palliative care consult for symptom control. That combines definitive treatment with supportive care. Both examples are short, specific, and assign responsibility, making them easy to convert into orders, referrals, and follow-up tasks. Be mindful of language that creates confusion. Avoid vague phrases like consider without specifying who will act and when. These leave recommendations open to interpretation. Don't omit the responsible clinician or timeline. Without them, follow-up stalls. And always document the rationale and any differing opinions. Undocumented dissent can lead to care delays or medical legal concerns. Recognizing and preventing these pitfalls ensures minutes remain useful, trustworthy records rather than ambiguous notes. Small process changes lead to big improvements in minute quality. Use standardized fields in your template so authors routinely include action, target, timing, responsible party, and rationale. After the meeting, confirm verbal recommendations in writing. A brief post-meeting note prevents misunderstandings. Assign a minutes reviewer to check completeness and resolve missing items before distribution. These workflow steps reduce variability, speed implementation, and make minutes reliable tools for clinical teams, audits, and patient care transitions. Clear, Templated recommendation statements improve patient care, accountability, and quality oversight. Effective minutes include a specific action, a clearly defined target, who and what, explicit timing, the responsible party, and a concise rationale linking decisions to data. Standardizing templates and workflows reduces errors, supports audits, and streamlines communication across multidisciplinary teams. If you adopt these practices, your tumor board minutes will become actionable, defensible, and valuable for clinicians, patients, and administrators alike.